We spend more than twice as much for health care per individual as does any other major industrialized country in the world. And yet, the World Health Organization has ranked us, at least 40 countries are higher on the World Health Organization's ranking than we are. So our outcomes are not so good, even though we spend an awful lot of money. And we have this huge amount of individuals who are uncovered, from 45 to 50 million who have no insurance at all. A large number, perhaps as large as that, who are underinsured. And recently we became aware that 45,000 people a year lose their lives because of lack of health insurance in this country. The House bill that's passed a couple of weeks ago is certainly comprehensive legislation. I think everybody knows it's over 1,000 pages long, but it's the first cut, and so it's fairly good. It provides a wide range of services. It's got some really good affordability pieces. It makes sure that people aren't denied service because they have a pre-existing condition. Currently, lots of people can't get health insurance because they have some kind of a pre-existing condition, and either they're unable to get insurance at all, or if they can get insurance, it's absolutely unaffordable. It will put lifetime caps. I think we've talked about some people who've had huge bills. The avoidance of lifetime caps and annual caps will mean that a lot of people won't find themselves in medical bankruptcy. Probably save quite a few homes from foreclosure if people don't have to worry about lifetime caps. So there's a fair amount of insurance reform in that legislation, as well as a set of comprehensive benefits, along with lots of other things. I think everybody recognizes right now that the legislation that's been introduced, both in the House and in the Senate, are kind of moving targets. In fact, debates going on in the Senate right now. They're staying late, they're working through the weekends trying to come up with a final piece of Senate legislation, which will then get merged with what the House has developed. So it's a little difficult to be specific. It's really clear that all of the bills have provisions for very small businesses that will allow very small business owners to get help. It's also clear that this will not affect large businesses. Large businesses will continue to offer health care services to their employees in the same way they do now. But it will certainly be very advantageous to families and individuals who need to go into the open market and make their own purchases. Both the plans will develop something called an exchange. That's sort of a medical marketplace where you can go and make a choice. It's also the place that low and moderate income families, up to 400% of poverty, will be able to get some assistance in paying for the premium costs. And that will be wonderful for lots of families who at this point cannot afford coverage at all.